Hi, this is Dr. Christopher Maloney, Naturopathic Doctor. I want to talk a little bit about how to choose a naturopathic doctor. We're actually in a wonderful situation here locally that we actually have 3 or 4 different practitioners. The difficulty is if you actually look us up, we seem to be all do holistic care of some kind. What people don't seem to say on their websites or in their materials is that various doctors have various different focuses. If you said to me, Dr. Maloney, do you do OB-GYN? I'd say, no, I do not. I do not actually have my patients undress with me as much as, if I need to see a certain body part for a skin disease, I might look at that, we might partially disrobe a little area. For the most part, my patients stay entirely clothed. I'm completely uncomfortable with doing OB-GYN type procedures. I can treat OB-GYN conditions but without looking at them, so I really want people to have an OB-GYN as well. I also don't do babies. I don't do the midwifery process or the birthing process. A number of other practitioners locally do a range of that, but don't advertise it for some reason. So they're very focused on childbirth, and that really affects and is the process of their practices. For me, I do a lot of chronic illness. I do a lot of kind of difficult cases. That's really the focus of my practice. I really find people who, for the most part, have not been able to find resolution elsewhere, whether with conventional or alternative practitioners. That's really the focus of my practice, is to spend the time and energy on individual difficult cases and come up with some resolution with them. I also treat those individuals as a member of a family unit, so I'll treat entire families. And that's generally, so I'll treat families and I'll treat chronic illness. If you said to me, what does you do most of the time? I also do a fair amount of body work with clothing on. That's not really massage, it's kind of a variation that I've come up with myself that involves spiritual, emotional, and physical work, simultaneously engaging the patient actively in the process rather than passively just letting them do their thing. So that's my practice. I would say that locally we have another practitioner who's primarily an acupuncturist. That's on her thing, but she also says she does naturopathic medicine. I would say she's primarily an acupuncturist. Another person's a midwife and a naturopathic doctor. She's primarily a midwife. Another individual has another specialty. So when you're dealing with alternative practitioners, the idea is simply that they have specialties. They may not have voiced those specialties to you, but you want to do something like get out of them what they spend their time doing for the most part before you invest all the time and energy with them, because they may not be a good fit for you. If someone came into me and said, I want you to help me help me during childbirth, I'm only moderately helpful. If they want someone who's going to be there, day in, day out doing ultrasound, that's not me. And if I'm actually straightforward, and I'll tell people that, but a lot of other practitioners will say, oh yeah, I can help. And my answer is maybe you can, but that's not really your forte. You want to find out what their forte is before you go see them.